We at the hospital today. I had to go get a registered nurse. And she is my beautiful sister. Who do I have the pleasure of interviewing today?
Hey everybody, it's me, SADE. I'm a registered nurse, and like she said, her sister.
I was schooling to be a registered nurse.
Hard, literally having no life. And for me personally, I had my son, he was, I think, 3 when I got accepted into the program, so it was hard. It was like literally, you had to be dedicated to that alone. There was no outside life. I would literally lay down until like midnight with him. Midnight, I would wake up and study from midnight until the next day. There was time to go back to class. You had to study. There was no way you could pass those tests. And those calculations are there without studying.
That's what I hear the most about, like schooling, like for nursing. Like the schooling part was the hardest part of the actual process.
I guess that's their way of like leaning out, who can do the job and who's going to be the best at doing the job. But absolutely, it was definitely worth it. If I had to do it again to be, where I am now, I would. But it's hard.
So with the NCLEX, that's the test that you take. Does schooling prepare you for that, or is that a whole nother studying thing?
I mean, they prepare you for it. So basically, at the end of every nursing semester, you have these different exams that you have to pass to go to the next level of nursing school, shall I say? And you definitely have to do an exit exam. That exit exam is a lot of the NCLEX material. Also, the school that I went to, Florida A&M University, Atlas, they actually did a lot of preparation for us. They provided us with CDs, with books, and even helped us like with the application process. So I definitely feel like nursing school, an accredited nursing school, prepares you for that test.
What actually is the NCLEX test?
Basically, it's a test of, this is a long time ago, so if I remember correctly, the total test is about 265 questions, and it tests you on a broad level of nursing. Everything from pediatrics, mother baby, pharmacology, pathophysiology, everything. And basically, by the time you get to question 75, if your computer shuts off and you don't have to continue, you either answered so many correctly that you're done in the past, or you've answered so many wrong, and even if you continue, you're in the past. So,
and then the test consists of like scenarios, or is it like dosages?
All scenarios.
Okay.
So some are dosages, some are select all. So basically, if you needed to say number 1, well, option 1, 3, and 5 are correct, if you only pick 1 and 3, the whole answer is wrong. So they make it where you have to study, you have to memorize, you have to know your values, you have to know what level of participation in kidney failure, what lab is considered a tumor marker to say a patient has cancer. Like, there's no way around it, in my opinion.
So you say that it's been so long ago. How long have you been a nurse, actually?
This year will be 10 years. I became a nurse in 2012.
And is nursing the final goal? Did you just say, I want to be a nurse, or did you want to be like a nurse practitioner?
No, I want to be a nurse practitioner. I like what I do. I started off as being a registered nurse at the bedside. I did 6 years at bedside on the heart failure floor, pretty much. From there, I did 3 years of nursing case management. So that's not bedside, but it is a form of nursing when you're basically in hospital setting, helping the patient prepare them for discharge, if they need to go to a nursing home, if they need help with medication.
I heard you mention bedside nursing, and you say you did that for 6 years. What is bedside nursing?
So bedside nursing is basically the nurses that are actually in the hospital, working hands-on with the patients. They're the ones that give them their medications. They're the ones that give them the shots. When they're discharged from the hospital, they provide the paperwork. And they're typically the nurses that work the 12-hour shifts, 6:45 a.m. to about 7:15 p.m., 3 days a week, every other weekend. But those are the nurses in the hospital that are, like I said, hands-on. Like, they're with the patients most of the day, more than the doctors, more than any other role in the hospital is the bedside nurses.
So if you was to typically say that you wanted to be a nurse, 9 times out of 10, that will be the actual description of being a nurse.
If you want to be a nurse, any nurse, you have to have bedside experience. I believe now they're requiring you to have at least a year of experience, but it's important because it is the backbone. How can you be an anesthesiologist if you don't know the background of anticoagulant and just other things that you're going to learn at the bedside? You cannot do anything in nursing without bedside experience. Like, I don't want somebody being a nurse practitioner to a doctor that I'm seeing and the doctor's not there and they come and see me but they have no bedside experience. Like, what can you help me with when you haven't physically been through it to gain that experience?
So with traveling nursing, I know with COVID, to me, with social media, that's all I would see, traveling nursing, how they make so much money. Did you ever do travel, or did you ever want to be a travel nurse?
I did want to do it because the money is beautiful, and also the nurses that I know that they have done it, they speak of really great experiences, just being the chance to be away from Miami and see other cultures and other cities. But for me personally, I just couldn't do it because of my children. It's just, for me, the money doesn't outweigh the memories, and I wasn't willing to be away from my kids. But to each his own. I give those nurses the most high props, but for me it wouldn't have fit into my life.
So would you consider this, being a RN, a registered nurse, your dream job?
I would. It's not what I said I wanted to be as a child. As a child, believe it or not, I said I wanted to do hair. But I actually went to college starting in pharmacy, and my son ended up having open heart surgery at 9 months, and that experience at Jackson Memorial Hospital just changed my whole perspective, and I went back to FAMU after his surgery and I changed my major to nursing.
So right now, as a registered nurse, you're not bedside. What is your title?
My title now is an oncology nurse navigator. Basically, I work with cancer patients. The reason I'm not considered bedside is because I'm not literally giving the patients medications. I'm not literally touching them. I'm not literally giving them chemotherapy, but I am navigating them through the process. Any barriers that my cancer patients run into, I'm their person. I'm the person that puts the pieces to the puzzle. The patient may need a medication and the insurance company won't approve it. I'm the person they come to so that I can, put the lines together. Or say the patient may say, hey, since I started chemotherapy, I feel this, and that, nausea, vomiting, or I'm weak. I'm the one that connects them with the doctor to say, hey, my patient is feeling this, and this. What can we do? How soon can we get them in? So I'm like their advocate. I'm the person they depend on. And I still have to have that bedside experience to know how to help them. What's the solution? You have this problem? Okay, so me with my experience, I know I need to talk to this doctor. Oh, me with that experience, I need to talk to the pharmacist. I am still, fulfilling my role as a nurse. Like I said, an oncology nurse navigator, and I really love it.
And how has that been with 2020? Like with quarantine, and has your role changed much? Or is it
I would say yes, because a lot of times we're told that we can't be in a room with the patients for a lot of time because of this whole COVID thing. Whereas before, I could sit down without a mask on, touch them and all of that. And even if you want to just put your hand on their leg, you just have some patients, especially cancer patients, who are just so afraid of this COVID. They're like, they don't mean to, but they're reserved because you just don't know.
Was it worse?
Definitely worse, I would say. Because even though I'm not bedside anymore, I'm still very hands-on with my patients as far as wanting to hug them, when you offer them support and encouragement, or just wanting to sit down with them and wipe their tears. And with the whole COVID thing, we're kind of limited on the amount of times we can be in the room with a patient because of the whole spread of infection. I remember just recently there was COVID going around in our facility, and I was called and they asked me how long was I in the room with the patient, and they told me to make sure that I'm not in the room more than 15 minutes because of the risk of contact. And it just didn't used to be like that. You want to be in the room with your patient as long as you need to get your point across, to make sure that they feel better, to make sure their questions are answered, and to kind of to know you kind of have a time limit to do what you want to do. Sometimes your heart doesn't work like that. Sometimes I need to say more to you. Sometimes I need to, like I said, give you a hug, wipe your tears, give you my phone number and say if you need something, you can call me on my cell phone, vice versa. I definitely feel like I have compassion. And I think that if you're not a compassionate nurse and you're just in it for the money, you'll fail every time. Like, this is a role and a position where you have to be in it to help people. Because if you don't, your patients will feel it. It's real. Energy is real. Vibes are real. And I just feel like I'm a very compassionate nurse. My patients are everything to me. And sometimes I even take this stuff home. I try not to, but you know, when you carry, it's like, I'm not, just because I walk through the door, I'm not going to forget that my patient has a few days to live because of cancer. I'm not going to forget that. You know what I mean?
Do you get hurt when like your patients pass away, or
I definitely get hurt.
still
After 10 years, yes, I definitely do. It's just something that for me, you just never get over it. You never are like, oh well, yeah, we already knew. I can know, like doctor saying, less than 6 months, and those 6 months come and the patient passes, I still feel it, and I'm still trying to, you know, reach out to the family, you know, for as long as they will allow me to just make sure they're okay. Because that's just, people are my compassion, and my patients are my compassion.
with COVID and everybody passing away, did your hospital make you guys take the vaccine?
They did.
And do you agree with the vaccine, like the studies?
For me, I feel like people in no way, shape, or form should be forced to do anything. And I think that I went to school to be a nurse. I worked very hard to get where I am, and I don't think that it's fair that I was forced to get a vaccine. I'm not saying that I'm against the vaccine, but I am saying that people have rights, and that was stripped from us. We were told you have until this date to be vaccinated, or you forfeit your position. Again, I'm not against the vaccine. That's not what I'm saying. If they're saying that it saves lives, great. But I still think that it's people's rights to, you know, for you to just take their jobs away. And so many people didn't stand for it. A lot of people left. You lost so many nurses. The nursing shortage now is at an all-time high. And I'm not saying it's because of that reason, but I'm saying in what we're going through, can we really afford to lose doctors, nurses, pharmacists, respiratory therapists, because we're forced to get a vaccine that we're still getting COVID on? Vaccinated, booster, everything, and still getting COVID.
Do you have anybody you know personally that just said no, I'm not getting the shot?
Yes, I know a doctor. She told me, like in another case manager when we were working, that, you know, today's gonna be my last day. I'm leaving. I'm not doing it. I have enough money saved. I'm gonna go live on a boat. And he was like, I'm not doing it.
So
I felt like a doctor, and I felt like, good for you. Because it's not just nurses, it's, you know, people in higher positions as well, like standing up for what they believe in.
Do you feel nurses are underpaid?
Anytime you have somebody in a position saving lives and they're 24/7 and the world can't function without them, yeah, I think we're underpaid. I'm not saying that the pay is poor, it's not. But I do feel like the raises that nurses are subject to each year can be a little bit more.
So, do you think nurses should pick up like a side job, or should being a nurse, I should save lives and make the most money?
I think that any job, any career, if you have the motivation, the drive, and the time to do it, then why not? It's never too much money. It's always good to have a hustle. But I will say that in my 10 years of nursing, I've only did one side hustle.
And what was that?
My eyelashes.
So you have an eyelash line?
Yes, BLINXX.
Are these your lashes you're wearing now?
Yes. And these eyelashes are just top of the line. They are like everything. You can wear them to church picnics, wedding receptions, baby showers, whatever, you know.
I know you've been loving lashes forever. We've been sitting in high school, and lashes to me, I feel like will be your first.
Yes, bury me with my lashes if something happens.
So how is that having a lash business on side of being a nurse? Is it hard?
I don't think it's hard. I think that because I have a passion for eyelashes, I love eyelashes. So when I do it and I make my bags and people ask me for them and I'm bagging them up, for me it's not work. It's fun because I really love to do it, and I really love that people are like wearing lashes that are attached to my brand, to my name. You know what I mean?
I like how you input like it's like you use your nursing lingo, like you like describe. It's like the details of showing, you know, like how it's gonna make you feel and stuff like that. I like that creativity behind that. Get your lashes. You're welcome. So, do nurses really have to clean like bottoms and stuff, or is that like a CNA job? Because I always hear people say, "Oh, you gotta wipe asses." Is that like a nurse's job?
I believe that it is a nurse's job. I've seen many times being at bedside nurses who absolutely will refuse to clean a patient if they have a bowel movement. Literally will let the patient sit there until the tech or the CNA comes. I've never been that nurse. Any CNA who has ever worked with me will tell you that. I've never been that person. I will help my CNAs do anything from draw blood to clean a bottle. Like, it's my patient just like it's yours. It's our responsibility. And if that was my mother, my grandmother, my child, like, I don't want somebody saying I'm a nurse. I'm not gonna do like.
So you would consider, obviously CNA is your assistant, so you guys are a team.
Exactly.
So, but like, what's the beef with the PAs, the physician assistant?
I mean, I don't have any beef personally with them, but I do see that in the hospital setting, realistically, a lot of times, the nurse practitioners, the PAs, the doctors, the nurses, the registered nurses are kind of looked down on. I guess they have a higher degree, they make more money, you know, they make bigger decisions. So I have seen a lot of like headbutting, a lot of barriers when it comes to that. But I stay out of it. I feel like if everybody's concentration is for the patient and what's good for the patient, healing and helping the patient, then that shouldn't even exist.
So when you say bigger, they make bigger decisions. Does that mean like filling prescriptions and stuff like that?
Like as a nurse, we can write orders, but not without a doctor's or nurse practitioner or PA's permission. We can't just do that. The only thing that we can enter orders for is without them is like regular nursing decisions. Like if I need to order maybe a bedpan for the patient, or if I feel like, hey, this patient has a wound, let's see if the wound care nurse can come in, assess them, stuff like that. But as far as like medications and stuff, no, we're not. We don't have the privileges to do that.
And how is the atmosphere? Like, are you guys like sisters, or is it like as the world turns? It's always like a story.
The places that I've worked, I feel like it's definitely a sisterhood, because at the end of the day, I need you and you need me. We can't do this by ourselves. Your patient may not be my patient, but if your patient telemetry monitor is ringing and you're not there, I'm going in that room to make sure that patient is still living and breathing and okay. You know what I mean? And vice versa. And when I see that you've done it for me, of course I'm going to be like, oh, thank you. Like, I appreciate it. It's not just, you know, I feel like where I come from it has been a sisterhood. We have to have each other's back.
Do you have any stories that you could remember where somebody came in and had your back? Or
definitely. I can remember having a cold blue, which is basically when the patient's heart stops, and when the cold blue bell, the alarm rang, and I was doing compressions. Like, my whole team came in, and you know, they took me out of doing compressions. Everybody jumped in and do something, because I'm the bedside nurse. When the doctors and the intensivists, the ICU doctors come in, they need to speak to me. They need to know, what is the last thing you gave this patient? What is the patient's diagnosis? I need to be able to answer those questions, so I can't be doing compressions and answering. So my team literally just jumped in, like, we got the compressions, they gave the IV, whatever the doctor asked them to do, they were there, and I was there to just physically take a breather and speak to the doctor, because it is nerve-wracking. You can't do it alone. You can't.
And so, with nerve-wracking situations like that, do you have to go through like therapy and stuff, or like how do you take it? Was that your first incident?
My first cold blue, my first year becoming a nurse, I feel like I took it really hard. I feel like I cried. I went home, I called my dad, and I never had another experience like that where I allowed that to defeat me. I took that and I learned from it. Yeah, it was my first time. I was fresh out of school, and this patient's heart stopped beating. I didn't know why, and I kind of I panicked. But after that, I took that as a learning experience, and I'm like, you're gonna panic or you're gonna save? You're like, which one? I choose to save every time.
So your younger self, younger SADE, anything you would like to tell her for your nursing process, your journey?
I'll tell her, like, back when all those days, like when I wanted to give up, like I said, I was one of the few people in my nursing class who had a child. I wanted to give up. It was days that I was like, I can't do this. I'm not smart enough. I'm not good enough. They're never gonna pick me. everything was so competitive. You only could fail one class out of the entire nursing process. And once you failed that second class, you were out of the program. And it was so many days that I just wanted to give up. And if I could just have seen myself now, like, I would tell myself back then, Sade, don't give up. You got this. It's in your hands. You're going to prosper into this. In 10 years, you're going to go from a bedside nurse to a nurse case manager to an oncology nurse navigator. Like, what they going to tell you?
I remember when you first started and the hospital that you work at, they give you like a bonus or something. So what if you felt like you outgrew the bonus, or what if you seen another offer that somebody had? Would you want to break that contract, or would you still fulfill the terms of the contract and just do the other job?
I think that it all depends on your happiness. And for me, when I left bedside to go to case management, for example, I took a pay cut, but I knew that it wasn't going to be long. At that point in time, I had gotten burned out at the bedside. Just to be like completely honest and real, I worked somewhere where it was just like, kind of, the doctors were being very like verbally abusive to the nurses. Not all of them, but the couple that did, you know, it stood out. I had a bad experience with that, and then I had a couple of bad experiences with patients being upset that I didn't speak Spanish. And I got tired of that, because I'm like, they hired me knowing I didn't speak Spanish, so why do I have to be verbally abused by these patients and their family members because I don't speak Spanish? You know, and I got tired of it, and I started standing up for myself. But I say it to say this: as far as the bonus goes, me personally, I would take more money if it's something that I want to do, but I will also accept less money if it's gonna bring less stress. That extra money, if I'm stressed out, guess what I'm gonna use that extra money for? Blood pressure pills, doctor's appointments, for what? Like, my blood pressure gonna be through the roof, I'm gonna be stressed out. So like I said, with when I got into case management, yes, I took a pay cut from bedside, but I did it knowing like it's a new environment of nursing, something new, and you know, I'm kind of done with bedside. Let me see what else nursing has to offer me, and how I've left case management and into something else.
And is this position you're in, is this somewhere you can retire from, or is it more?
Oh, yeah, absolutely. Okay. But it's also something I can elevate from. Like, there's so many like oncology certifications that I can get just to take me to the next level. Like, it's just so much that I can do. But I'm just starting here, so
just gonna bask in the type.
Exactly.
Girl.
So up to date as a nurse, what is your proudest or most, happiest moment that you can say that?
I would have to say my most proud or happiest moment was when I found out that I got the position that I'm in now. Like I said, I'm a cancer nurse navigator, and I could just remember going on this interview, long story short, in August of 2021, and the interview was the most intense interview I've ever been on. It was a panel of like 8 or 9 oncology nurse navigators. Mind you, I've never worked with cancer before, so the odds were against me. I didn't have experience. And I did so well on that interview, and I could just remember them not calling me. And I'm like, I'm gonna reach back out to them. I reached back out to them, and I was just telling the manager, thank you. From what I understand, you guys decided to go with somebody else, but thank you for the opportunity. And if the, opportunity ever presents itself again, I would love to be a part of your phenomenal team. And she's like, what? Oh no, stay by your phone, because there's one more position left and it's reserved for you. Like, I'm really grateful to be where I am, because this position is something that is hard to get into. And they're not gonna just hire any nurse. And like I said, like, the favor was on me because I didn't have oncology experience. And so to just come into this field and into this new facility that I'm in and just be able to work with these nurses who are just amazing. They're so knowledgeable. The patients, the cancer patients, are just the sweetest people you can ever meet. I just feel like from here, it's only up. Nobody could have told me that I would have been like in this position. I always look at the nurse navigators like, wow, like they're, look at their documentation, like they're so amazing, they're so this, and guess what? And it's only up from here.
How do you make it in Miami?
I had to make it in Miami successfully. You have to have multiple streams of income. It is so expensive to live here, and it's hard. Like, you have a great job, working a 9 to 5, and you're tired, you want to come home to your kids, sometimes it's not enough. When you got to pay $1,200 to $1,500 for a one-bedroom apartment here. I feel like to make it in Miami, you need to have a mind of your own. You cannot, or you should not, be a follower, be a boss. I feel like you definitely have to watch your surroundings. The killing over this stuff that is just so unnecessary. All of these people, these children who are being left parentless because of the stupidity. When we go out, like, let's have a good time. What is all the violence for? Like, and I know I'm just whatever. It might go in one end out the other, but it is senseless and it's not fair for these children. And their parents go out and let their hair down and have a good time, and they never come back home because y'all killing each other for what? So I feel like, yeah, you better have you a Thule. But more than anything, to make it in Miami or anywhere else, you have to stay prayed up. God is the solution to everything, and there's nothing else to say about that.
So anything you want people to know?
I just want to say thank you to my beautiful sister, because I'm honored that she chose to interview me. And to anybody who wants to become a nurse, I don't care how old you are, it's never too late. It's a very promising career. I love what I do. And just know that I'm a fun nurse. I'm a registered nurse by day and Carisha City girl by night.
Period. Thank you, sister girl.
Love you.
Love you too.
Learn how to make it in my